Legionella McDadii is named after Joseph McDade, who is who originally found Legionella. So it's been around for a long time. But we certainly have been seeing it more in our immunocompromised populations. And I think that's partially because our diagnostics have gotten better. We do more cultures in patients, so we can identify patients with Legionella. And I think, you know, our awareness of Legionella in general has gone up, and so we're focusing a little bit more on making sure we identify these patients. They can look a lot like other infections, so they can have findings on a chest CT or on a chest X-ray that can look like another type of infection. And so it's really important, and one of the messages that I try to get across to people is if you're dealing with immunocompromised patients, to really make sure you do cultures, so either sputum or preferably even BAL in patients that have pneumonia. And make sure you send it for Legionella cultures, because you can't identify these non-Haemophilus species by the typical urinary antigen test, which is often sent in patients like this. It's an interesting area because we focus a lot on legionellosis in the general population, but the patients at highest risk are patients who have underlying immune deficiencies or are receiving chemotherapy or other treatments that really limit their ability to respond to normal infections. So they tend to be patients that we sort of describe as canary in the coal mine. They sort of ones that can identify a particular problem with a water system sometimes, and are the ones that sometimes show up first with with Legionella infections. And they're particularly interesting for us because they often have Legionella that are not typically described in other populations. So we see what are called non-Haemophila Legionella. So Legionella Haemophilus serotype 1 is the most common in the United States and really around the world. But the non-Haemophilus species like Legionella McDadii or Legionella longbeachii are actually sometimes seen in our population. So it's an interesting different spin on Legionella that we usually don't talk about as much.